Standard mechanical back pain most often stems from the daily physical stress and compression of the spinal discs. However, a more aggressive type of pain typically targets young adults between 20 and 40. Ankylosing spondylitis, or AS, is a chronic autoimmune disease where the body's defense system misidentifies and attacks its own healthy tissues. Genetics drive this autoimmune response. Many patients carry a specific protein marker called HLA-B27, which effectively serves as a beacon that directs the immune system to attack the spine. Because this pain is inflammatory rather than mechanical, it follows a unique pattern. Symptoms worsen during periods of rest and only improve through physical movement. As seen on this anatomical chart, the disease primarily targets the axial skeleton and sacroiliac joints, where the spine connects to the pelvis. The immune system attacks the ligaments anchoring these joints, initiating inflammation deep within the lower back. This process results in severe morning stiffness, a hallmark symptom that requires physical activity to loosen the affected joints. In these early stages, the inflammation is invisible on standard X-rays. This non-radiographic phase means the disease often progresses undetected during the most effective window for treatment. The biological damage begins at the enthesis, the specific point where a ligament or tendon anchors directly into the bone. Inflammation here causes fluid buildup and tissue damage. While this is visible on an MRI, the bone itself hasn't yet begun to degrade. The attack can spread beyond the spine, leading to Achilles heel pain, entire fingers or toes swelling into sausage digits, and even acute painful eye inflammation known as uveitis. Left unchecked, this localized inflammation triggers a systemic response that eventually forces the human skeleton to physically remodel itself. As the disease advances, the chronic inflammation causes the bone at the corners of the vertebrae to erode. The body heals this erosion by forming bridging bone growths called syndesmophytes. These abnormal structures extend across the disc space to meet the adjacent bone. Eventually, they connect completely, permanently locking the vertebrae together and turning flexible joints into a rigid block of bone. This 3D medical reconstruction shows the final result, a rigid, continuous structure with wavy edges, known as a bamboo spine. This CT tomogram confirms the impact. The white arrow points to the fused vertebrae, and the red arrows show the pelvis has fused with the spine. This leads to severe immobility, fixed posture, and a high risk of unstable spinal fractures. Modern medical strategies stop this structural damage before the immune response results in permanent spinal fusion. By identifying AS early, clinicians can disrupt bone formation and preserve the patient's mobility. This vintage photograph of patients performing seated arm exercises reflects the long-standing use of supervised physical therapy, land-based exercises, and daily stretching routines to manage the disease. While standard mechanical back pain may require rest, patients with AS must stay active to keep their spine from stiffening and to maintain their posture. For medical management, doctors prescribe the continuous use of nonsteroidal anti-inflammatory drugs, or NSAIDs, to reduce inflammation and slow the progression of bone damage. When physical therapy and NSAIDs aren't enough to control the disease, advanced medical treatments can target the autoimmune response at a cellular level. Biologic therapies are used for patients with highly active disease. These medications are engineered to block the specific proteins that drive the autoimmune attack. Most biologics for AS fall into two categories: tumor necrosis factor inhibitors and interleukin-17 inhibitors. These biologics intercept the inflammatory signals before they can reach the tissue. They act as blockers, binding to proteins and preventing joint damage. Once blocked, the chronic inflammation fading, halting disease progression and protecting the spine from further fusion. Ankylosing spondylitis is aggressive, but early recognition combined with targeted biologics and consistent physical therapy allows patients to protect their mobility and rewrite their long-term prognosis.